This is Dr. Akl. I am a cancer specialist in Flint. Today we will be talking on diagnostic test versus screening. Screening of cancer to the population, they need to understand that when you say screening for cancer, meaning the patient has no symptoms and on examination is normal examination. We call such test is screening. For example, when we do a mammogram in women above the age of 50 who are entirely asymptomatic, they examine the breast, there is normal examination and the patient has no symptoms. When you do such test in group of patients, we call it screening. So screening usually in a normal population, in a group of normal patients, has no symptoms and examination completely normal. Then the question comes, what screening benefit our patients? 3 cancers where screening could benefit them. How? Cancer of the cervix, cancer of the breast in women above the age of 50, and colorectal cancer. Those are the 3 cancers where screening benefit. How? Benefit means increased survival, meaning if you diagnose it early, treat it, yes, there is increased survival in comparison to group of patients who do not have screening. So the end point of screening is increased survival. Very good. So what we do here is do a test in normal population who has no symptoms and examination entirely unremarkable, we call it screening. And only 3 cancers where screening lead to increased survival. Cancer of the cervix in female by pap smear, that lead to diagnose cancer of the cervix early, and the treatment would result in increased survival. If we compare those patients to those who had no screening, then yes, the screening is beneficial. So number 1, cancer of the cervix, and the test is pap smear. Number 2, breast cancer in women above the age of 50. It has been shown that screening of women above the age of 50 lead to increased survival comparing those screened to non-screened, meaning when patients start to feel symptoms like lumps or bumps, then that is those group of patients versus those who has no symptoms. The result of screening on women above the age of 50 with mammogram, that result in diagnose it early and treatment result in more chance of cure. So the second cancer is breast cancer. The third cancer is colorectal cancer with stool for occult blood. In normal patient has no symptoms, no bleeding, examinations are remarkable. When you do take sample of the stool, look for blood, we call it occult blood, that result in increased survival for those 3 cancers. Someone will tell me, what about chest x-ray every year to detect cancer of the lung? I tell him, no, that never proven to result in increased survival. Why is that? Because they did a big study, thousands of patients in one arm. Those underwent chest x-ray every year versus those who diagnosed when they got symptoms like cough, chest pain, coughing blood, and so on. They found there is no difference, and the screening did not result in increased survival. That's why we do not do chest x-ray screening for lung cancer. someone will tell me, what about we do PSA for prostate cancer? Is that a screening test? I'm telling him, unfortunately, or fortunately, whether you like it or not, those studies that showed whether you screen for prostate cancer by PSA, prostatic specific antigen, in normal population, that did not result in increased survival. Let me put you on a hold for a second here. There is difference between screening and diagnostic test. What's that mean? If, for example, you see in your doctor, you have urinary symptoms, frequency, nocturia, means you go a lot to the bathroom at night, and when your doctor examine you do rectal examination, they feel a nodule in the prostate and so on. Then he send you for PSA and send you for biopsy and so on. This is not screening. This is diagnostic test, because you already have symptoms, increased frequency, you go to the bathroom a lot, and when he examined your prostate, found something iffy there. They did blood test, the PSA, whether it's slightly high or low. Maybe if it's slightly high, it is judgment here whether you have cancer, or you might have just benign enlargement of the prostate. So your physician and your urologist will keep working on that until finding why you have these symptoms. That we call it diagnostic test, and that is totally different from screening. So in summary, endpoint of screening, increased survival. Those cancers where screening benefit is cancer of the cervix, when you screen with pap smear for normal population, no symptoms, examination entirely unremarkable, we call it screening for normal population. Cancer of the cervix, or screening for the cervix, that yield, if that came back as positive and treated, result in cure. So cancer of the cervix, mammogram in women above the age of 50, and occult blood stool for patients above the age of 40. This screening test results in increased survival, and it is recommended to be done. And that's totally different from diagnostic test, where you have symptoms like bleeding per rectum, then they're gonna send you for colonoscopy and further investigation. We call it diagnostic test. Or there is lump in the breast, we send you for ultrasound or a mammogram and biopsy and so on. This is diagnostic test and totally different from screening. Screening in normal population, screening showed benefit on only 3 cancer: cervix, breast above the age of 50, and colorectal cancer. Others like in the lung, other prostate, everywhere in the body, screening did not show any benefit. That's totally different than if you have symptoms, your doctor go to diagnose these symptoms by doing special tests. So screening is important, and you need to be screened if you worry about those 3 cancers, and you need to be in the right age category, and your family doctor will help you.